Welcome to the Mental Health Minute podcast. My name is Chris Salyards, and I'm the Executive Director for the Bridge Youth and Family Services. We provide mental health and family stabilization services to youth and families in our community. Through our podcast, we will talk to partners and experts, learn from Bridge staff, and talk with individuals who've received support through our services and who've become stronger as a result. Normalizing the conversation around mental health creates healthier individuals, families, and communities. Looking forward to sharing with you. Welcome back to another episode of the Mental Health Minute. I'm Chris Salyards, Executive Director for the Bridge Youth and Family Services. Today I have with me Susana Shymanik, Clinical Director for the Bridge. Welcome.
Thank you.
Why don't you tell the listeners a little bit about yourself?
Yes, so I've been the clinical director at the Bridge for 3 years. I received my master's in 2014. From there, actually, the Bridge was my first job. So I was a bilingual therapist doing direct work with clients for about 3 years there, moved to a supervisory role in the city, and then now I'm back as clinical director.
Yes, and we're glad to have you back.
Thank you.
What did you get your master's degree in?
Forensic psychology.
Forensic psychology. Mm-hmm. Okay. And how do you think that degree has served you in your practice over the last 10 years?
10 years, I know. It's crazy to say it, right? 10 years that I've been in the field, but it served me a great deal just because of the programs that we're developing now at the Bridge, working with the juvenile justice system. And so I worked with juveniles in probation before as my internship, and still currently working with them now. And I love what I do in terms of developing programming for that specific population. But also in terms of like trauma-based services, I was able to get a lot of practice in that as well, and working with adolescents who have been through severe trauma because of gang involvement or whatnot. It has helped in that sense as well.
Excellent. Mm-hmm. And I know one of your passions when we were talking 3 years ago, when we both joined the Bridge, your passion is really to bring strong mental health supports and services to the Spanish-speaking community.
Yes.
Talk to me about that.
Yeah, so one of the things that I learned very quickly once I graduated grad school was that there was a lot of stigma within the Spanish-speaking community when it comes to mental health. They did not want to talk about it. They do prefer that it stays within the family. At most, maybe a pastor or a priest would know about what was going on. And so I really enjoyed the psychoeducation piece to the families, bringing them what is mental health, what it is that their kids are going through and how they can help those their kiddos with the struggles that they're having with mental health. So,
and you brought your vision to life at the Bridge?
I did.
Say more.
So I was able to really engage parents through that psychoeducation, doing parenting groups, and being able to present to parents. We have a lot of connections with the schools, and so I was able to bring, communication with kiddos and bring that to parents in the school setting. And so schools would allow me to go in there and talk to parents about that. And now just developing programming that also resembles that now. So it's really good.
And you've built a strong bilingual team at the Bridge.
Yes, I have. Yes. We currently have, I believe, 5 Spanish-speaking clinicians at the Bridge. So That's amazing.
That's wonderful.
Yes.
And due to your leadership. So thank you for bringing that gift to the Bridge.
Yes. Thank you.
So today I wanted to bring people closer to your expertise, to the Bridge's expertise, and talk a little bit about adolescent mental health. How have you seen mental health issues in children evolve over the past decades? And are there specific trends or shifts that concern you?
Yes. So I feel like mental health now is very well known. I feel like post-COVID, there has been more talk about mental health, which has reduced some of the stigma around mental health. But I do feel like there has been a shift in terms of it. Now, it's something that our adolescents know more about, our children know more about, but there's still a gap with the parents. And so I feel like parents, still have some of that old school mentality. No, they'll get over it. Or they just unfortunately don't understand what's going on with their kiddos. And so there has been that shift. So that's one of them. Another one is post-COVID, right? So now we're seeing a lot of our younger kiddos, talking about 3-year-olds to 5-year-olds, who lack that socialization piece. And so we're seeing a lot of behaviors that are being shown in the schools, whether that's dysregulation, so a lot of hyperactivity running around the classroom. And unfortunately, teachers don't know. I'm sorry, not that they don't know. It's hard to handle that type of behavior when one child is doing that and you still have, 10 to 15 that you still have to teach. And so we're trying to also help that pattern or that trend, that is happening with mental health. And so helping those kiddos regulate. And anxiety, we know that it has also been on the rise post-COVID.
Right. Mm-hmm. Yeah, I think going back to what you said about the classrooms, teachers, you have teachers who are specialized in special education, but then you have your standard, teaching program. And when you have kids who are displaying symptoms of trauma or behavioral dysregulation, and your job is to manage a full classroom and address the needs of each individual student, now you're taxing what is traditional. So I take your point very seriously. And I think that we've been in conversations with the schools about how we can help leverage some of that or ameliorate, I suppose, some of those issues in the classroom.
Yes.
Have you seen particular age groups or demographics being affected more? I know we've talked post-COVID about the 3 to 5s, and I know we know our adolescents know a lot more about mental health than maybe we as parents care to acknowledge. But do you, in your practice, do you see certain demographics affected more than others?
I feel like mental health has affected everyone. What we are seeing more of is the Asian community coming in more. And I don't know if that's because of just mental health is out there more. And so they feel more comfortable now coming in for services. It's a great thing that they are coming in for services, but we have seen an increase in that specific population. But yeah, I think mental health has been affecting everybody everywhere. So
yeah. I learned yesterday something that is interesting to me, and that's that our family stabilization program, we have a lot more females that come through the program than males. That was shocking to me when I learned that. Why do you think that is?
I'm not 100% sure. I know that females, I think all adolescents get into fights with their family, but it might just be more with females because of that independence that they might want afterwards. After a certain age, 15, 16, they want to go out with friends, they want to do things. And so parents might be putting more boundaries that the kiddos are not used to. And so, you can see them acting more out. They don't like something, it's easy to go to a friend's house or run away from home or go to somewhere else that isn't their home. So I do feel like it might just be a little bit of that.
Yeah. And just hypothesizing, because I have nothing to base it on, but I'm wondering if, it's more common for boys and adolescent males to play video games. And it feels like it's more common for our young females to fall into a TikTok loop, right, in social media.
Yeah.
And so I guess I wonder if we were to dig into that, if there's anything behind that, because, if you're playing a video game system, you're leaning into a community that you've built and that you've escaped within. I'm not saying it's healthy, but when you're in social media, you're inviting yourself into a multitude of communities that are giving you influence from various things, good, bad, and indifferent.
Right.
So I'm just wondering if that might be something for us to look into. Yes. For sure.
For sure. Yeah, because we don't have that data, and it would be good data to have, because it's interesting that it is more females than males. Because one of the things we've learned, and I've learned throughout my years, is practicing with males mostly, is that they do tend to be more they more act out and more impulsively than females. Females tend to think through things a little bit more. And so it's interesting that data came up.
Yeah. Mm-hmm. Sorry to put you on the spot. No. So let's go back to mental health in youth. And how much do you think environmental factors like family stress, economic hardship, trauma, how much do you think that these extenuating factors affect kids?
A whole lot. I do feel like, as I've been working at the Bridge, we do see a good fair amount of trauma that these kids come with. Talk about ACEs, whether it's abuse, neglect. Now we have environmental factors such as hurricanes or tornadoes. Witnessing to violence is still an ACE, so whether that's they unfortunately witnessed gun violence or a friend committed suicide, all of that affects their mental health. And so being able to obtain that help, right after, if possible, is very important. I think a lot of us don't really think that adolescents take in the family stress, but they do. One of the things that I remember as a direct staff is talking to a lot of my youth, and they were saying, well, my family has financial problems. And I'm like, oh, but that's an adult worry, not a adolescent worry. And they were like, no, but I have to work. I also have to make sure that I do things to help my family move forward. I can't just go to school. I'm like, but that's your main job, right? Your main job is to be a kid and to enjoy your adolescent years. But a lot of the times when there's financial difficulties or there's, conflicts within the home, they take that in, and it does affect their mental health. And then you have them come up, having anxiety, or they start to feel low and have depressive symptoms. And it's because they are taking all that. And now I'm not blaming parents or anything like that, but it is a stressor for them.
Sure. Mm-hmm. And is it a universal, or do you find that there are certain cultures where you find that more?
I would say within the Latino culture, I do find it a little bit more, specifically when it comes to financial stress within the home. One of the things that I have found is that kiddos do come in and say, I have to work. If they could drop out of school at 16, 17, they would, to be able to help the family. Because again, their basic needs are not being met. And so when your basic needs are being met, everything else becomes, goes to the back burner.
Yeah, right. Thank you for that. Mm-hmm. So as we shift gears now, thinking about, so we've focused on the kids, and now let's talk about the helping adults in kids' lives. How can adults differentiate? I have teenage daughters, right? And so I often think, how do I know that this is a mental health issue, or is this just normal teenage angst? How do I know the difference?
I think when, as parents, your kid the best, and you know what their behaviors are. When they become, for example, if you have a kiddo who's very active in sports, active in school activities, and then all of a sudden you start seeing a shift in that, right? They do less of the sports, or they don't hang out with friends as much. That is probably one of those various symptoms that you might want to start looking into, maybe talking to them a little bit more as to what's going on, that I don't see you as active anymore. Are you stressed out? How can I help during this time? Because those are, even though they might be subtle, it's still something is going on, right? I'm not saying that they're completely having major depression diagnosis, but it can be the beginning of something, and we would just want to make sure. Or maybe if they are just overthinking a lot, right? You have some kiddos that might be asking you a whole lot of questions. Well, how do you do this and why this? And so is that their typical behavior, or is that actually their brain on overdrive trying to make sure that they get everything ready? And because we might be looking at anxiety at that point. So we just want to make sure that they get the help. And if you don't know, it's always good to ask. It doesn't have to get to the point of my child has isolated, doesn't want to do anything, to ask for help. It doesn't have to get to that. We can always ask for help when we're starting to see a change as well.
Well, and one of the things I know, I have a lot of friends with teenage kids, and the biggest complaint is my kid is always in their room with their door shut. And of course, when we were kids, it was okay because we didn't have cell phones. So we were doing something in our room, but no, it was me in my room by myself, not me in my room by myself with an entire world to dip into, right? So I think there's a lot of parents who question, where's the healthy balance there? What would you say to them?
Yeah, I mean, as a parent, you have that authority almost, in terms of like screen time, because we do hear that a lot. How much time should we allow our kids to use their phones or their tablets? And honestly, it is up to you as a parent. If you say 2 hours, it's 2 hours. And then, but you have to make that a consistent rule, right? It can't be 2 hours today and then 6 hours tomorrow. It has to be consistent. So the kids are learning. And then, I mean, another thing is just having open conversations with your teenagers. What's going on? How are you doing? You were on Facebook today, or you were on TikTok, because I know that's huge.
Nobody's on Facebook except for us old people.
You were on TikTok, because I know some teenagers love to do TikTok videos. So are we just doing a TikTok video for the week, or are we doing one a day? And maybe just limiting that. And so as a parent, you do have that authority to set those boundaries within your home.
And people are afraid of that.
Yes, they are.
And why do you think that is?
I feel like there's so many reasons, but I do feel like a lot of the times it's like, I want to be able to relate to my kiddo. I want to be, I want to be the cool parent, or and I think we can't be afraid to set those boundaries. You can be an amazing parent, a cool parent, but still have boundaries within the home. Because at the end of the day, you are the parent. You are not the friend. And so having those set boundaries and rules is going to be important for the kiddos in the long run, for sure.
And I've started to talk to my own teenagers about, do you know your phone is bullying you, and it's rewiring your brain, and it's making you think like this. And I just want to make sure you're not falling into a dopamine crash, So we have these very open conversations because I think, again, language is so important. And the more tools you can give them to understand the reasons behind the loving response, which is, I really care about you and your brain, and I want your 30-year-old self to appreciate that you gave yourself healthy limits on your cell phone so that you got good sleep, you're able to study, because the decisions you make today will affect the decisions you get to make your senior year, your junior year, right? Yep. So just continuing to help them frame what's really going on with their phone. And I'm not saying that they appreciate it, and I'm not saying that they go along with it, but whenever we talk about how much time have you spent on your phone, look at your screen time, then you tell me if that was a healthy amount.
And modeling that behavior as parents too, because you can't ask your kid to not be on their phones for, a certain amount of time, or be on their phones for a certain amount of time, but you're on your phone all of the time too, whether it's because of work or family stuff comes up, it has to be modeled within the home as well.
So I took us off task, but I'm glad we did, because I think that the phone situation is a huge point of contention, or the root of a lot of unhappy feelings in families, right?
I learned from a friend not too long ago, actually last month, that she has a like a place for her phone, or like her phone lives somewhere. So when she comes home from work, she has something near her door where she puts her phone in, and she doesn't touch her phone until everything in the household has been done, whether that's cooking, dinner, etc. It's not until the end that she picks it up again. And I think that's such a great idea for families to do. Just, have a little home for your phones. When everybody you get coming through those doors, put your phone there. Don't pick it up until bedtime if needed. If not, then just continue on, right? Without using it, and pick it up in the morning. Because again, that allows you for that family time to have those conversations with your kids.
I love that idea.
Yeah.
I think it's going to be a stretch goal. So since we talked about how to talk to your kids, how do you think parents should be talking to their kids about mental health? Mm-hmm. I know every day I say, how was your day? Mm-hmm. And I get boring. Mm-hmm. Every day you ask me, every day it's the same. And so I'll try to find a way to ask the question differently that yields a different response. Mm-hmm. So what tips do you have for people who really need to have some of these tough conversations?
Yeah, so open-ended questions is the best way to go with that. But it's not, one of the things I've learned, it's not just to ask, how was your day, but tell me one of the greatest things that happened to you today. And then tell me one of your lows today. I think conversations like that, it opens the door, because now you're having them think about what was good about my day today? And if nothing, then what was my lowest point and why nothing was good? So it gets them to think a little bit more. I also believe when parents are having conversations with their kiddos, it needs to be distraction free. Mm-hmm. You can't, especially if you're asking these types of questions, because, one of the things that tends to happen is that we're cooking or we're watching a TV show, and are we actually listening to our kids, right? Are we actually listening to what they're saying? And so making sure that we have all distractions off, TVs off, we're not cooking, especially if they want to have a serious conversation with us regarding whatever topic. We want to make sure that all eyes and ears are on them, basically, because we want to give them our undivided attention. But yeah, I think, asking questions like that would be very helpful for them.
And I sometimes find when I'm having a difficulty connecting with the kids, I go in and I'll pretend to clean their rooms while they're in bed. Mm-hmm. It's like everybody's in the bed, the mm-hmm. house is shut down. So I'll go in, I'll start picking up socks off the floor, tying up their garbage. Mm-hmm. And they think it's a gift because I'm cleaning their room. But really, I'm giving them the space to initiate a conversation. Mm-hmm. And they do. Mm-hmm. They do, because it's just us in their room, and they're starting to feel just a twinge of guilt that I'm picking up after them because mm-hmm. they are old enough. But I do find that can inspire conversation, which then allows me to invite myself to sit mm-hmm. down and just lean into that. So allowing them sometimes to mm-hmm. lead that when they're ready. Right. I know, especially having teenage girls, there are times they do not want to talk. Mm-hmm. I do not want to talk about it. Mm-hmm. I just, or I just want you to hear what I have to say and don't give me any opinion. Don't mm-hmm. say anything. And it's good data.
Yeah. And I think that's one of the things that I believe parents struggle with the most is the opinions and the advice. When I've talked to and have done family work, it's like, I know this one's going to hurt, but the best thing you can do is just lend an ear. Don't give opinions. Don't give advice. Because then it shuts them off pretty quickly. They start thinking, well, why am I telling you if I'm going to hear mm-hmm. A lecture, or I'm going to hear X, Y, and Z from you, and you're not really listening to me. So
yeah. And I've heard it from my kids. The minute, like, oh God, you're not going to give us a lecture, right? Mm-hmm. And so I've learned to have a quieter mouth mm-hmm. and bigger ears. And I think that has really opened up our communication, mm-hmm. even though I don't agree with everything they say. My daughter has 19 opinions about what's going to happen at school and all of these fantasies. Yeah. And I'm like, I just keep self-talk. Don't say anything, because some of these power struggles work themselves out. Right. And I don't have to engage. I can mm-hmm. just be a patient listener, and mm-hmm. I wait. And then all of a sudden, she comes to a different decision. And I'm like, okay, so we saved our relationship and I'm still a good listener.
Right. Yeah. And sometimes they'll ask it. I think one of the things that as parents, we have to sort of sit by and ask to be like, Mom, give me that advice. What would you do in my situation? Right. Then that's when we can definitely go in and give our opinion and advice. But we can't. It's better to sit back, like you said, and listen. And hopefully they work it out. But if they don't, they come to you and ask you about it. Ideally, for sure.
So leaning into this a little more, what do you say to people who might make the mistake of minimizing what's going on with their kiddos? Like you said, they'll get over it. Or sometimes do things that make their kids feel unheard. Lectures is a perfect example. So what advice would you give a parent who is in this trap of making these continuous mistakes because they feel like it's how they were raised. They didn't go through the therapeutic process themselves.
Right.
They don't understand what it's sort of like, do as I say, not as I do.
Right.
You know what I mean? And
Yeah.
I'm really minimizing that, but what would you say to them?
Come see us. No, just kidding. But I do feel like they could, take these tips of, let me just listen. A lot can happen if you listen for 5 minutes to a kid, and what does listening mean? It means, again, bigger ears, smaller mouth. Is that what you said? So you don't talk. You engage with them. You have direct eye contact to make sure that they know that you're listening. You summarize and paraphrase what they're saying just to make sure that you're understanding where they're coming from. And again, that advice piece, just don't do it. And that's actually something I do give my families when we start working on communication within the home is no advice giving unless it's asked. And that's probably the hardest thing to do. But I think it's the most effective because then they can hear their kids and really listen to what it is that they need from them as parents. So I do feel like those are good tips for them to take. Now, if it's hard for you, practice it. And it doesn't have to be a difficult conversation. It can be you initiate a conversation and now just sit back and listen. Don't say anything else and see where that conversation goes.
Good advice for all of our relationships. I've learned in my life, nobody really wants my opinion. Nobody's paying me for it. So I'm like, okay, well, I'll just keep it to myself and we'll have this conversation again tomorrow.
Yeah.
So on that point, active listening strategies. I think it took me a long time to learn that I was not a good listener. And I had to practice a lot. And I went to school to be a listener. So what strategies would you give to parents to practice being a good listener?
Yes. So those open-ended questions are going to be your go-to. So an open-ended question is anything that doesn't have a yes or no at the end of it. So there's a difference between me saying, how was your day? Good or bad, right? I'm giving you just two options versus tell me a high about your day. Tell me a low about your day. Again, distractions, anything. And I know that's a little harder with parents who have more than one kiddo, which is, and that's when you're wanting to have conversations with your children it's taking them, maybe you do almost like a date with one of them, right? Like, let's go get ice cream, just you and me, and have those conversations, taking them apart from their siblings so that way you can connect with them at a deeper level. And again, just listen and ask the questions you want to ask, but at some point, once they're responding, you just listen. You don't do anything else. And try not to be distracted. That's why the nonverbals are very helpful. So, eye contact is very important. Making sure that you are summarizing what they're saying is also very important. And I think, one of the stats that I always take with me is that a lot of when communicating with somebody, your nonverbals, people pay attention to your nonverbals 70% of the time. They only hear your words about 5%, which is amazing. So it does say a lot when you're sitting down in front of somebody, really looking at them and listening, because they are looking at your nonverbals. As soon as they see you get distracted by anything, their mind goes, well, okay, I guess this is the end of our conversation. So it's very important to have that.
And that's an important thing because, I like to teach de-escalation, and de-escalation, we talk a lot about this and how you are presenting in the space when your kid is having a crisis about something. It could be they're worked up about something that happened at school, that their sister stole their hairbrush. It could be any little thing that seems trivial. Giving it the time that it needs and allowing yourself to be present in that space is a great co-regulation strategy, and also allows your kids to know, oh, I know this is really dumb, but you're here in this moment with me also. And so I can depend on you. And so I think I find that is such a great opportunity for families to remember, because how you are, I always tell people, if you're in someone screaming at you, do your very best to just go to your baseline, stick all your emotions in your back pocket, take a deep breath, and think about what's happening here. How can I help this situation? And engaging in, competing for airtime is not the way to do it. It's turning on those ears.
Right. Because again, when it's funny because it just reminds me of some of the family sessions I've had before, because I do say, when you're competing, when somebody's talking to you or you're in an argument with somebody and you're already thinking about what you're going to say to that person instead of actually listening what they're saying, you're never going to come to an agreement. Nothing's ever going to be solved because you're just trying to get the snappiest answer to them, and just a comeback. You're just looking for comebacks. And so where's the resolution in that? And nobody's listening to each other, and you end up angrier with each other and nothing gets solved. And so it's funny because my families, when I say that to them, they're like, she knows. She knows what we do. And it's important. And the same thing I tell parents is, what you say and how you say matters. So if you're screaming at the top of your lungs to get your kiddo's attention or telling them to go do the dishes, there's a difference between that versus saying, hey, once you're done with your homework, I need you to do the dishes, right? What you say, the words you use definitely matters as well. So,
yeah. All great tips for us to work with our families. One of the things that I've noticed about my own kids is, verbal dialogue in teenagers is very challenging because they actually prefer to text each other. I can't tell you the times that I've walked in and two kids sitting on the couch next to each other are texting each other or snapping each other. And I'm like, why are we doing this? Like, you're sitting right next to each other. So sometimes I know something I can do for my kiddos is when I've observed something or I've heard something or I've noticed, I'll send them a text, which is their preferred communication style. And I will say, I just want you to think about this. And then when you're ready to have a conversation about it, like, I want to talk about this with you because I think that's really important. This is my observation. And it doesn't work every time, but it works more than not because my teenagers being the texting generation it's really hard for them to have eye contact. It's really hard for them to have a face-to-face conversation because everything feels confrontational, everything. And so I think sometimes laying the foundation of putting words, 5% of your communication in words so they can play with what that means for them and have a response, I think has been very helpful. So also just a tip.
Yeah. And iMessages are huge. I think when we're in arguments with our kids, it's a lot of times, well, you didn't do this, or this is what I'm not getting from you, etc. Versus what you're doing is making me feel X. I feel this, I need this from you. Or I feel this because, and then I need this from you. Putting it on ourselves, let's also remember to share feelings, because if we're sharing our feelings, it's most likely that they're also going to be sharing theirs too.
Mm-hmm.
So.
And I read from a doctor a doctor of social work, actually, and she said in one of her books, Untangled, she said, to expect your kids to respect you is an unrealistic expectation. She said, because teenagers, by their nature, they are disrespectful. But if you as a parent expect kindness, that is a way to start to build those foundations. And I thought that was a really interesting thing. Because how many times do we hear people say, don't disrespect me, don't disrespect me? So I try really hard in my own home not to use the words respect me, respect my decisions, respect. I'll say what you said was really unkind, and I just want to give you some time to think about another way you could say that. And it lands differently because they understand kindness, but they don't understand respect.
Yeah. And I think when you ask them, and there's been times where I've asked adults, what does respect mean to you? And they don't know what to say. It's just, a word that has a meaning, but they're not sure what that means for them. And so it's important, if you are going to lay that foundation out, like you said, to your kiddos. Respect means kindness, or respect means etc. And it's going to be a lot easier for them to understand it. But to say it and not have meaning behind it is, it's going to be hard for a teenager to understand if an adult can't either.
Right.
Yeah.
So what are some small but impactful ways that you think families can support their kids' mental health on a day-to-day basis?
Yeah, I think small talk is good. Having these conversations, whether it's, going to their room and cleaning, or actually opening up that conversation. But I think just also little things, routine is huge for kids. Sometimes we don't think that routine is something that is impactful, but it is, especially if a kiddo has a diagnosis of ADHD or ASD. I think routine is necessary. Structure is necessary for kids because, I think a lot of them do unstructured stuff already. And so their only structure might be school. But if they have a routine, that can be very helpful for them. But also spending time with them, quality time. Do you know your kids' love language? Is quality time something that they enjoy? And if they do, spending that time with them, that does help their mental health, because then they feel like you are interested in them. You are able to spend this time with them, and, I know hugs can be underrated, but I do feel, like some kiddos sometimes just need a hug from their parents. Do you actually hug your kids and, say, I love you? And do you do positive affirmations with your kids? One of the things that I remember teaching my nephew, who's 4, is when we were FaceTime, I would say, repeat after me. I am strong. I am brave. I am, to teach them that affirmation that, because they are that, and having them believe that is important too.
For sure. And we talk a lot in our house about, how can we do something together that doesn't feel forced? Spending time with teenagers is really hard. Like, they would rather be with their friends. It's hard for me. Like, they would rather be with their friends. I get it. But it's, can you help me with dinner? Oh, you're so good at that. And feeding them those elements of you're really good, and establishing their value to themselves. I even texted my one daughter today and I said, stay true to who you are, remember your values. And that's all that matters, and I believe in you, and you can do hard things. And all of these things are, your verbal hugs. I read an article once that said that kids need 12 touches to thrive, to survive, and 16 to thrive. And so that's high fives, that's hugs, that's, pats on the back. And finding ways. My kids are porcupines. I love to put my kids in the center of attention here. My kids are porcupines. I have one who's not, but everybody else is like, oh, don't touch me. But it's then using those verbal hugs that really help them.
Right.
So, touch is not their love language. Check that off the box. So, I think just reminding parents that parenting is extremely hard.
It is.
And it's always changing. What's the right way? What's the wrong way? Everybody's got an opinion about how you parent. You don't even realize what your family thinks about you until you have kids.
Yeah. And that's the one thing that doesn't come with a manual, there's books on parenting, but everybody's so unique to their own. Like it's you can't just go through A through Z. It's going to be very hard. So yeah, it's the only thing that doesn't come with a manual, and you need to learn on your own as you go, for sure.
Yeah. So I think as we start to wrap up, what message do you have for parents or teachers or caregivers who feel overwhelmed or uncertain about how to best help young people?
Yeah. I think it's, what a lot of what we mentioned today is having, I think looking internally first, seeing what are you bringing to the table when you're having these conversations with kids? What's going on with you first, and if you're able to regulate, do so. And then having that conversation and listening to them. I think that's the biggest takeaway, is just being able to listen, actively listen to them. And I think you'll get a lot from that, and ask for help. Honestly, like if you don't know, or if you're having trouble with that, just ask for help. And, whether that's a friend or a professional, the teachers or whomever, just ask for it. And, I know there's a lot of people that can help.
Excellent. Is there anything you want to share about updates for the clinical program at the Bridge?
Yes, we don't have a wait list. So if you do need services, please call us. We don't have a wait list, and you'll get assigned right away. And groups are to be determined soon, but we are starting to look into bringing groups to the agency as well for the community.
Okay, wonderful. Well, thank you for coming on and talking to me today.
Thank you.
Thanks. Thanks for tuning in to the Mental Health Minute. I'm Chris Salyards, and please look for us on bridgeyouth.org, follow us on social media, and look for more information coming from the Bridge. Thank you.